Thanks. It's my absolute pleasure to be here, and thank you very much for inviting me, and congratulations to UCD Scientific Committee for organizing such a fantastic conference and learning a lot. And I've been in U21 for a while. For the last 2 years I missed, and wonderful to come back to this community. And I also, huge pleasure to follow Ronan and Marie and their fantastic talk. And what I hope to do is add a little bit of additional insights into the area of social media, and more specifically focus on health practice and health education, some of the evidence that's there. And I'm really looking forward to the panel discussion together for that conversation. And so I know many of you amongst the audience from previous. I also get to meet many new faces, and look forward to getting to know you. Ladies and gentlemen, I really enjoyed last night. Fantastic choir with the UCD. And I was very fortunate. I was sitting right next to the stage. So I not only could hear the harmony of the voices, but also hear the individual voice in that choir. I know that, in fact, there are a couple of medical students in there. And also, I think a couple of them are descendants of people in the audience. So really, congratulations. And the other thing is this, that in fact, at one point, I felt like singing with them. Of course, I'm glad I didn't, because it'll ruin your entertainment. But there's a word that I thought about. It's called resonate. And in fact, for our Chinese colleagues here, the Chinese translation of that is sing together, to sing together. And so to hear that harmony and that voice. And I think I'd like to focus on that piece to think a little bit about what Marie talked about e-patients, about thinking about the social media. It's not only about broadcasting, not only about sharing, as Ronan pointed out, but it's about resonating. It's about individuals who participate, who says, I want to get information, but I want to give back information. I want to focus on that particular point in health professionals in terms of how we can potentially, in real time, use this information for our activity. So in the next half an hour, I hope to try to truncate it down to around 20 minutes so we can get the discussion, is first a very brief definition about social media and its usage, and then really then focus on a workshop that we did in Vancouver, where we actually examine and look at social media for health. What's the evidence? What do we know about? What don't we know about? And then look at some of the strategies forward in using social media for health. And then really a bit of a call for us as U21, can we work together on this, in this exciting area? So social media, of course, does not equate Twitter. Twitter does not equate social media. You've heard both Ronan and Marie give many, many examples of different kinds of social media. But really, it's a collective term to talk about a set of socio-technical approaches for people to connect, for people to support each other, and for people to learn from each other. That's social media. And in fact, there are many different kinds of technology, and people use it primarily for purposes. And I welcome your insights. The 4 C's. Number 1 is to look for content. I really want to go there so I can learn the type of information that I need to hear about it. I want to go there for comfort, because I want to go there to share the examples that were given about the health society, the medical society, the nursing society, the health professional communities, and also peers community. So I can share some of my pains and some of my issues to resonate with my colleagues, with my peers. But the third is about communication, to say what else is out there in addition to this group. How else can I follow other people? How else can I get linked in to other groups? To how do we increase the type of network? And number 4, how do I reflect? In fact, Martin, where are you? You were blogging. Yes, Martin, you and I discussed about the fact that, in fact, part of the kind of a tweeting, do tweets is not only about having our colleagues learning about the things that we are learning, but actually helping me to reflect. I know that Professor Jum yesterday spoke, for example, in his lecture. You're talking about medical management is complex, like a Sony television, right? But the delivery of it doesn't need to be complex. So when we go and buy a Sony TV, it doesn't need to be complex. And so by me tweeting that particular point, not only is a great insight about patient safety and management, I get to anchor it into my memory now because of that tweeting. So it helped me to be able to reflect on the things. So why do people like social media? I'm not trying to say that we're looking at ourselves as lab rats and say, geez, why do we like it? But these are some of the really important areas that we need to think about. One is rapid. It's rapid. A rapid output, so we can get a point, get it anchored, and send it out and share. As rapid input. For example, my daughter loves the social media. Within about 2 weeks, she got like 3,000 friends on Facebook. I don't know how she does it, but she did. And so she said, we just went to Europe for holidays in the summer. And so she, instead of, historical me, go, I got 20 people network. So, I send out my emails to 20 people, say, I'm going to Europe. But what she does, post it on her Facebook, 3,500 people immediately know that she's in Paris. And that's how they share information, very efficiently. And the friends will post on their wall. And so all they need to do is just read the wall. They get information plugged in, really rapid. And secondly, one of our colleagues here, Professor L.C. Chan, many of you know, he always says, be in the moment, be in the moment. And so it's not just about the fact that it's rapid output and input, but at that particular moment, that's what impacts me. That's what resonates with me, and I want to share it. And so being that in the moment itself, I'll come back to the implications of education, implications for healthcare practice in thinking about that piece. Number 3 is to be able to maintain the type of relationship. Again, being in U21, having this community, meeting every year, we build up relationships. But also, when we go away, how do we continue this relationship? Of course, we have individual emails, but also as a group, how do we resonate together? How do we maintain that relationship? How do we expand new linkages? The new friends that I get to meet here, the people that we get to start working with together. How do we maintain those relations, expand? And finally, how do we learn and share? A lot of people go to social media because of learning, because of sharing. Again, Ronan and Marie give you wonderful examples of that. Marie talked about patients like me, fantastic network, and she gave example. I'm not going to dwell on it. Here's another group called Cure Together. So this is one of the things that what Marie talked about. This is a group of people who have chronic fatigue syndrome. And they ask each other, well, what's effective? What's effective for you in terms of managing your chronic fatigue syndrome? And so they actually mapped this out. This is non-health professionals getting involved and very actively involved in this. For clinicians, it has clear implications for us. To be able to know that, for example, frequent short breaks is helpful. I mean, this is, again, as prescribing information that we talked about, I mean, this is fantastic information that's very popular, but also appear to be very effective amongst this group. But then, when we prescribe medications, there are certain medications that down there in that area, it's not that effective, really not that popular. And the implications for us, if we were to prescribe some of these medications, is to understand where they come from, understand where we come from as patients, as health professionals. And then, I don't know chronic fatigue syndrome. I didn't know that low-dose naltrexone seemed to be very effective, but not quite popular. Something for me to look into if I were learning about the fact, where's the evidence of naltrexone? Is there evidence? Should we know about it? Now, again, I want to emphasize this is not randomized controlled trial. Yet, this is very important information for us to know, to partner with our patients, to work together, to understand. Because our patients are looking at these types of graphs, and how do we acknowledge it? How do we leverage that type of information? Now, how many of you know about a quantified self? Again, a movement over the last 5 years, really starting to not only think about sharing information, but sharing their biometrics, sharing their data with people. We have now monitors, biosensors. Your mobile phones can track your activities and your things. Here's an example of a person who says, who's been tracking their calories. And so blue is morning, red is lunch, and then green is evening time. Now, this was posted on the net, on the website, so it's freely shareable. But what really impressed me is this, that we know on average, people, 2,000 calories daily intake, maintain your weight. And if you eat more, you tend to gain weight. You eat less, you tend to lose weight. So depending on whether you want to gain weight after illnesses or lose weight because you want to get fit, that help us. But by tracking, this person not only knows what his or her, I don't know the identity of this person, not his or her own specific caloric intake is to maintain weight. But this is really interesting. He said, my behavior is predictable. I lack disciplines on the weekends. So she tweeted that out. And so the reason for that is, so if you look at the spikes, is where all the weekends when he or she had a binge. You know, could be potato chips, could be movie, could be anything. I have no idea. But you can then see a valley right after, especially the extreme one is right here. I used a high-tech shadow pointer. Whoops, sorry, I didn't mean to advance that. Here. So you can see that valley, that goes down to 1,000 calories. I learned that, in fact, when I go to a regional, I'm not going to mention the company, a hamburger with onion rings, that's 1,050 calories. 1,050 calories just to eat a hamburger and onion rings. And that person on that particular day only had 1,000 calories. But the problem for this individual is overall, it's about 2,300 calories, so likely he or she might be gaining weight. And number two is that after these, he or she feels guilty and going to this low caloric intake. But again, the reason this person shares is not only because he or she wants to show this off, far from it, but we as a community can support this person and say, geez, how can I help you over the weekend? How can we support you so that you can do this? And I imagine that he or she does this because he or she feels that this is a great way to understand about his nutrition, and he or she might want support to do this. And so again, social media is not just about sharing information, not just about networking, but it's about reflection, it's about resonance, it's about helping each other. An example, there was an earthquake that happened in Vancouver, October 27, 2012, Saturday night. I remember that night in that sense. There's not much damage in Vancouver. It was in a quite remote area, thankfully, so not much damage. And I remember I was doing some work, Saturday night I was doing some work, silly me. And then 11:30, I went downstairs and watched the news. So I was sitting in the news. I still remember my son was, leaning on a couch, doing iPhone, doing his own stuff, etc. Right? And the news comes on and said, there was an earthquake. And I quickly turned to my son and said, son, that's why you need to read the news, because you keep using iPhone, you don't know the world. We just had a major earthquake. And then he said, Dad, it's old news. It's old news. It's all over Facebook and Twitter. Stupid. and it's true. In fact, the earthquake was 8:04, and within about a minute, the first tweet came out. And then US actually started tweeting it within about 10 minutes. And the Canadian organization start tweeting in 1 hour. And in fact, by the time I got the news 3 hours later, really old news. In fact, that was a Vancouver Sun article documenting the social media spread. In fact, there was a joke saying that social media actually spread faster and ahead of the earthquake, ahead of the wave. So when we think about social media, not only in general, but now for health, what are some of the things that hold us back? What are some of the things that are issues? There are real issues. And I'm not suggesting holding us back meaning negative, but it's a critical look. And that's what we need to go. So what about accuracy of information? Very important. What about the depth of information? At the end of the day, we absolutely want to support our e-patients. We absolutely want to support our patients in general. But what helps us is because of the training and things, we have the depth of knowledge for us to offer. So how do we couple with social media for that? And the breadth of knowledge. How do we know the information is trustworthy? It's not only about snake oil, but if someone says, I'm an online nurse, I'm an online pharmacist, I'm an online physician, how do we know? How do we know? How do we form the right relationships? Healthcare is a high touch area. How do we translate that high touch onto social media? And how do we make sure of those medical legal issues? Patients' information get texted out without permission, sharing of it. Or what about professionalism online? Those are real questions that we as individual health practitioners and also the institutions where you have stewardship on education, on practice, on research, these are areas that we need to think about. Very fortunately, last year, we, as a group of us at UBC, 5 faculties, medicine, library science, nursing, business engineering, went to UBC Institute, the Peter Wall Institute of Advanced Studies. Very fortunately, got funded to look at a research workshop, specifically looking at how do we harness social media so that we can build communities of health and wellness. And so we have very specific 5 areas of inquiry. One is, what are some of the ways that information are being acquired and applied through social media for health? Number 2, how do we look at community genesis and sustainability? Dublin, beautiful community. I live in Vancouver. How do we define a community? And sociology has certain rules why we behave certain ways. Online behaviors, online communities, similar rules apply. We are human beings, so there are certain rules that apply, but new rules get generated. Just because geography got taken out, that there are new rules that we apply. What are some of the ways that communities form and sustain itself? And how do we design those communities? What are some of the technological aspects of design? And then within that content, how do we manage knowledge? How do we disseminate knowledge? And how do we renew knowledge? And in implication, how do we look at trustworthiness of that? How do we exchange those knowledge? And finally, what are some of the things that we know and don't know about? And what designs do we need to think about? Not just health professionals design, but how do we look at library science design in terms of business design, engineering design, or nursing design, and health professional approach in research? How do we do that? And so that was a workshop, and very fortunately we got funded for it. And it culminated to, in February, we're able to actually bring 30 people together, researchers together, in different disciplines to actually have that conversation. Very enriching, very stimulating conversation. And as part of it, that night, on Monday nights, we actually had a public forum. We want to engage the patients. I want to reemphasize what Marie said, nothing about me without me. And so we love to engage our general public, not just not patients, but general public in that conversation. We only had 2 weeks to advertise that workshop, so we didn't know, that forum, we didn't know how many people showed up, but surprised us. We booked a room, 150 people, thinking that maybe half full. We have 195 people showed up. We have 100 people participate on web on the 60-minute presentations and discussion and panel discussion with 1,000 tweets. And then we have 1.12 million impressions. What impressions on Twitter is that when you text out a tweet, what's the number of people who likely will see your message, will likely see a message? And so they do not necessarily respond, but they may be able to access your message. And for a little workshop in Little Vancouver, planned over 2 weeks, to have that ability to reach that kind of number, again, it's another kind of issues and power of saying, well, how can we leverage this media so that we can reach more people, not because we want to show off the workshop, not because we want to show off forum, but how do we socialize it? How do we exchange that knowledge together? And so we end up with great discussion about where's the evidence. The evidence is definitely emerging. I'll show you a little bit more about that later. We won't be going through all the evidence, of course, but there's evidence in a qualitative manner about social media for health. Huge opportunities and great case studies. But the issue is, how do we quantify it? How do we quantify it? And so again, research designs and how do we as an interdisciplinary group work together becomes very important. How do we quantify that over the next few years? Number 2, supporting the public to actively pursue knowledge. What's the best way to do it? What are some of the best practices? We heard of some of those today, but how do we characterize best practices of that? Number 3, how do we help health professionals embrace and use social media? We know that the general public is very enthusiastic. We know that our students are in it now. They grow up with that. That's how they do it. But in general, health professionals are a little bit reluctant to embrace it, more freely to embrace it with health professional social exchange, a little bit more hesitant in communicating with patients and general public. How do we help ourselves to embrace it? And how do we look at the quality of information on social media? The interactivity is a very important area. There's no question about the fact that knowledge, and one of the things I'm very glad I'm in an academic institution is knowledge that's shared becomes more powerful. In corporations, when you have knowledge, you try to capture it, you try to put an IP around it so you can make money on it. I'm very glad that we're a community where we generate knowledge, we want to share it, because the more it gets used, the more capital it gains, the more ability for us to use it. So it really resonates with the whole social media to be able to share that knowledge, to increase it, to work with our patients, work with our health professionals together to build it up. The interactivity becomes very important. And also the evolution of social media. I mean, just now, with the recent arrival of Vine, which is a 7-second looping of video, drove me nuts. My daughter, again, very social media, social butterfly, social media butterfly. All through our Europe trip, she was taking these 7-second loops, keep showing it online, and go. There's an art to it now on Vine, and also a lot of people now doing Instagram, taking a quick photo in the moment, show how they feel, they share it. So all these different kind of evolution, I mean, it's not going to end today for sure. It's going to be a lot more in the future. How do we take advantage of it in knowledge exchange? And so we are very fortunate. We got 2 publications that editorial accepted in the Journal of Medical Internet Research. I'm hoping that within a few months, if you're interested, maybe Carolyn, I will park those. I won't flood your social media sites with that, but if you're interested, love to share that with you. And so I think there are kind of 4 areas I think it's important for us today to start thinking about leveraging social media for health practice, for health education. One is about health policy application. I think it's important for us to then look at what evidence is there today so that we can start to influence health policy. And I'm going to give a little bit of example of UBC, what we do, not to say that we're the best in doing this, far from it, but that's our journey in looking at this area. With that workshop, we're very fortunate to engage the BC Patient Safety Quality Council, and they're very interested in looking at social media to actually look at the issue of quality and patient safety. And so we're working with them now on our second follow-up workshop to look at using social media to reach safety and quality. What are some of the principles that guide it? And then we're looking at a specific case example of residential care in terms of medication use. Very often, these individuals will have lots of multiple pharmacy, multiple medications. Very often, the family members are very concerned, and rightly so, and want to make sure that they can connect with their loved ones in those settings. And so how do we use social media as an example to increase safety in residential care medication use? And it involves patients, caregivers, health providers, and policymakers. So we're hoping that next year, again in February, that we'll be able to generate some recommendations and thinking around it and really apply it into British Columbia to move that forward. Also very fortunate, we got an expert coming to our workshop in February from PAHO, Pan American Health Organization. And in discussion, we're very interested in looking at, well, how do we build capacity? A different issue about e-health, using technology for health service delivery. We are looking at how do we use social media to build academic institutions' collaborations and contributions to building capacity in e-health. So again, another manifestation of the health policy using social media to accelerate the health practices. Second area, engaging our community, engaging our public, engaging our communities together. Again, Marie and Ronan both make a very, very strong case. How do we engage our health professional communities? How to engage our public communities? What we're doing is in British Columbia, we're actually looking at the use of a combination of social media, text messaging, and also biosensors, helping diabetic patients as an example of chronic diseases, so that individuals not only get the information through social media, they can get the biosensors to measure their own response, blood pressure, glucose, weight, and the response through exercise pedometers. Very often, when we say, go exercise, 30 minutes, 3 times a week, the patient will say, well, I just had a heart attack. How hard should I exercise? And so having biosensors not only help us to help them calibrate the exercise, but help us to understand, well, if they get their heart rate up to 130, the blood pressure starts to drop below 80. So even in general, if we were to say that you want to exercise to 60 or 80% of your cardiac output or your ability to exercise, for you, you may need to reduce a little bit more. But for you, you can actually go a little bit more. And so the patients have the ability to calibrate his or her own responses to the type of activities. And by that, we learn. Just like that patient that person who's tracking his or her own calories, we learn about that case example to say, here's the pattern, and what are some of the patterns that we can help our patients to move that forward. And so we get a grant from Public Health Agency of Canada to do the social media part. We also get 2 grants on the biosensors part to actually look at this particular type of management of chronic diseases. Third area, interdisciplinary research. This is not just about health. This got to be a collaboration with our engineering colleagues, with our computer science colleagues, sociology colleagues, psychology colleagues. Huge area of opportunity collaboration. And here's a little bit so this is just one aspect of it. When you tweet, there are 3 phases of tweeting. The first phase is you tweet out the message, right? So chirp, 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 chirp. So the example of earthquake, right? So the first phase came out. There is an earthquake. The second phase often is get retweeted. So RT means retweet, or MT means modified tweet. I add my own perspective to it. So this is the second bird saying retweet, add bird next to me, chirp, chirp, laugh out loud, funny bird noises. So that's the second bird. And so the second wave of tweeting is very often retweeting. So again, I experienced it with the earthquake because the first wave, they tweet out earthquake. The second wave, hey, retweet earthquake. So huge escalation of that. But the third wave is important. The third wave is when they start tweeting about their feelings. And so in this case, well, what are you talking about, this funny noise? I'm not going to translate WTF. You can translate among yourself. But the third wave is expressing feelings. And in fact, the third wave is in the earthquake, are you okay? I feel anxious. It's coming to me. You know, I'm depressed now. My family is destroyed by this. So third wave. In fact, New England National Library of Medicine about 3 years ago actually did an experiment on looking at social media on influenza. And so they used social media to reach a crowd and then spread out the information about influenza spread. Very interestingly, factually, they were able to accelerate the knowledge that gets disseminated. But more importantly, by a type of engineering type of research called natural language processing, by interpreting the words, by analyzing it, that they actually detect emotions of how people feel about influenza. You may have heard about Google, 24 hours before a flu outbreak, that community actually start looking up more information about flus and colds and symptoms, et cetera. So these type of surveillance become so important. And we now have the ability to start thinking about, well, not only do we look at what they said, but what are emotions behind it. And then again, yesterday, Professor Lucas and Professor Payne talked about network analysis and how the networks and different people communicate, another huge area of research about that kind of analysis. So interdisciplinary research is very important. I'm going to focus my last 5 minutes in looking at health professional education. We are educators. I think Dean Murray spoke very elegant about that. Dean John Fraser also spoke to that. As a community, that's where we are. And so where do we lie in our responsibility, our privilege to be able to use the positions that we have to influence education through social media? We've been incorporating e-health into our 4-year medical curriculum over the last few years. And there's no questions that are emerging skills of health professionals, very important in this e-world. Number one, how to use technology to deliver services. Telehealth, mobile health, very important to know about apps, biosensors. But social media is right in the center of it. How do we, if we believe in patient-centered care, if we believe that activated patients have better health outcome, and Marie showed us some evidence, in fact, there are a bunch of evidence suggesting that an activated patient that involved has better health outcome. How do we involve our patients? How do we involve our public in this? How do we use, for example, social media to do that? I heard a scholar actually speaking about social media. He himself was sharing his experience. He had a daughter who had an illness, and he didn't disclose it, which is fine. And he said, I researched it, and I found a whole bunch of information, and then I took my daughter to my physician. I shared my information, and the physician, within 2 seconds, dismissed it and told me this is the correct way to treat my daughter. He said, the doctor was right. My daughter get better. But I never could go back and see him because he didn't acknowledge that I tried to help my daughter. That's a very emotional response. And I can definitely appreciate it, because many times, sometimes when we try to, I go to government, ask for grants, the completely got dismissed. I go, but this grant is to help, Even if the government says, I acknowledge you, it makes me feel better. In a very small way, but in a very, not small, but a very important, subtle way, patient wants to be acknowledged, the fact that they want to participate. I think Maria speaks very, very strongly about that, and I want to reemphasize her point. How do we acknowledge it? How do we know, if we believe in patient-centered care, we gotta acknowledge that. And so how do we leverage that? And social media is one way to do that. And EHR, again, look at microsurveillance of patients, macrosurveillance of a patient population, and couple with genetics. So those are some new skills. And in fact, this list of illnesses and approaches in text messaging, I submit to you now, today, has randomized controlled trials to prove benefits. Randomized controlled trials on using text messaging to increase medication adherence, to look at surveillance, to look at smoking cessation. It's there. The evidence is there for us in this particular field, in text messaging. We have also been serving our first-year medical residents. So in residency, we have many from UBC continuing on in residency, but also across the country, and also in, small group international students. So we asked them the 22 ways that we can uncover in using electronic technology for learning. What are the ones that they feel comfortable using, which is the red line, and what are the things that they like to use more throughout the next 4, 5, 6 years of residency? In fact, the green ones that are circled are either directly related to social media or related smartphones, YouTube, online community practice, blogs, etc. And in fact, what we want to do is we want to find areas where they have high comforts and they have desire to high use, and that's what we want to leverage and invest our energy in delivering electronic health learning approaches. But the other thing we want to do is to learn about where there are low comfort level but high desire of interest. And that's what we want to leverage that. Electronic portfolio, online community practice, those are some of the areas. And some of the areas that I need to learn is, for example, YouTube. I mean, now I get in the habit of, if I don't know how to use this piece of equipment, the first thing I go is go to YouTube and figure out how to use this equipment to learn about it. The students taught me that in terms of moving it forward. And so social media and health professional education, I think there are several things that we need to look at it critically. Critically not in a negative way, but critically in an evidence-based way. What are some of the utility of social media? What are some of the good practices of social media in health professional education that we need to leverage, that we need to use? How do we introduce that? And also, what are some of the enabling policies of social media use? We have good policies. For example, definitely don't tweet about patient information. Fantastic, very important policy. That policy is to protect the individual and protect the institution and protect the patient ultimately to make sure the information is not mistreated. Do we have enabling policy? Not to say, don't use it for social media for this, but do we have policy to say, do use social media for that? I think it would be really important for us to start thinking about, well, what are some of the types of enabling policy we need to do together? And in fact, there's a bit of paucity of policies out there. And also look at educational research. How do we leverage, if what's missing in evidence, how do we leverage social media towards that? The analytics, so that we can use Google or Hootsuite Analytics to look at reflections, emotions, and also the whole area of reflection. I'll come back to that a little bit more. And so, ladies and gentlemen, I suggest those are 4 areas that we're exploring in terms of how do we continue to move social media forward on health professional education and improving practice. I welcome a discussion whether you disagree, agree, or whether additional areas that I miss on those areas. And finally, a few trends. Here's an important trend. For the first time, 2012, there's now a report that documents that globally, there are more people with access to cell phone than safe water and electricity. So when we look at this, and when we look at the historical debate, when you go to underserved community, do you bring water or do you bring a computer? It's remote. It's mute now. The technology is there. Are we going to use it? Are we going to leverage that technology to improve care? And mobile is a huge area. Social media is moving mobile. In fact, many of us now tweet through our cell phone, iPhone, and tablet. In fact, I learned a new word, phablet, a phone that does tablet, a phablet. So we're using these technology now. So how do we continue to go forward on that? Secondly, it's multimedia. It's not just about text. It's about pictures, about videos, about sound. Bring all that together to increase the resonance, increase the emotions of it. Number 3 is granularization. I mean, historically, I was just talking with Kevin upstairs. Thanks, Kevin. Historically, I would buy a vinyl, buying a CD so that I can have the one song that I want. Of course, now we go to buy songs, right? We no longer go buy a whole song. In fact, we download free songs from YouTube. Same thing with text. I mean, historically, we write essays, and then we kind of move on to email, and then we go to Twitter and Facebook, and then we go to SMS, text messaging. You know, my daughter hit about 1 million text messaging for last year. I go, how did you do that? Well, when I look at a phone, you know, one text message is like, you know, LOL, TXX, etc. You know, so very easy. Another quite interesting insight. My son got into a summer job in research. So I told him, you know, you got to thank your professor for this. So do that. And then he very sincerely, and he wasn't joking, very sincerely said, yes, I do need to do that. So let me think about that. Let me plan for 2 or 3 days so I can send an email to him. So for me, I was thinking, you know, why don't you write a letter to him? But for my son, an email is that kind of formal thinking piece to write that. So huge difference in culture in some ways. And video, same thing, you know, movies and kind of moving to YouTube, 3 to 6 minutes, kind of moving to these vines of about 6 or 7 seconds, Instagram in 1 second. So really kind of start granularization. On an educational piece, let me suggest this one educational theory amongst many, the Sean's theory about reflection in action, which is while I'm treating a heart attack, what do I need to reflect on so that I can treat better? A bit of formative evaluation, if you will, and then reflection on action. After I treat 20 heart attacks, I really should look back in my 20 heart attacks and say, what do I consistently miss? And what are things that I've learned? And I submit to you that electronic technology, social media, has the ability in those granular moments to look at reflection in action, and all those summative moments to look at reflection on action. How do we use social media in the best way so that we can take advantage of these understood pedagogical theories and apply into practice in electronic realms? Last trend, big data. Big data. So all these data coming, electronic health record, electronic medical record, the big data genomics, you know, the genes, expressions, etc. The big data on information out there, and the big data on social media. When we talk about e-patient today, to have the live interaction, how do we understand the big data that will be coming through the emotions of social media, through the understanding, discussion, social media, and couple that electronically with the big data that we have to truly manifest a global approach to patient-centered care? I would submit to you that those are 4 trends that we need to keep an eye on, especially as we are the educational institutions. How do we leverage that for practice? And so this is my final slide in terms of a bit of a call. Again, I want to thank Jason for inviting me and the UCD community to invite me to this discussion. And Jason and I, and also spoke with Martin, spoke with Manuel, spoke with Qian Xu from Fudan, and spoke with Damien from Birmingham. A group of us are interested in looking at, well, can we actually leverage U21 together to learn together? Learn about what are some of the utility of health professional education amongst us in the different U21 organizations and also in literature. What are some of the best practices out there? And what's some of the evidence? Really to answer the question, why now? Why do we want to do social media now for education? We also want to kind of survey ourselves to say, well, what are some of the policies that we have on social media? And what are some of the things that we're missing that we may want to think about in policies in social media to answer the question, how now that we can actually put it forward and move our institutions towards social media? And then to look at the educational research and say, well, what's missing? What's unknown? What's interesting? And what's coming down the pike? And how do we leverage that? And so really it's about answering questions where to or where the future. We're hoping that over the next year that we can actually participate and absolutely need interprofessional collaborations, absolutely need all the health professionals working together on this, and we absolutely need students, absolutely need students. There's no question. I'm a pretend digital native, but our students grow up with this technology. So how do we do this? And we hope that we generate resources on some of the best practices, some of the policies that are here so that we can share amongst our organizations, but really generate some papers for discussion, and hopefully next year in Fudan that we have a chance to actually share some of those recommendations and socialize it further together. And so this is a shameless ask. We'd love to have as many people interested as possible. Would that be, maybe I'll just ask a quick show of hands, would that be of some interest to some people here? Great, thank you very much. I'd love to get your input. So feel free to send me an email, and thanks to Jason giving me permission to flash his email up. So please join us. So I'm going to conclude with this. This is from wisdom from the men's washroom. Someone wrote, Descartes' theory is to do is to be. So by doing, we get to understand. And Voltaire says to be is to do. By thinking about it, we're already moving it forward. And of course, our poet of this century, Frank Sinatra, says, doobie doobie doo. Yeah. I learned a lot from, oh, sorry, one more slide. I learned a lot from men's washroom, as you can see. I think, ladies and gentlemen, very promising social media. I hope that you get a sense about this promise of social media, that we can leverage it, not only to just use it, but understanding the theories behind the pedagogical, so we apply it to our education. We are taking this to where the learners are. They are there already. We need to move our institutions, our education towards there. And we need the academic scrutiny of this to understand what's the best practices to do this. And we need to then set the enabling policies to move us forward and look in the future to see where the evolutions are. And I hope that we will be just like the UCD choir, to be able to find our academic voice so that we can resonate together to move social media forward. Thank you very much for your attention.